Hello, good morning. Yeah, my dear friends. Yeah, good morning, good morning. It's another Saturday. Time actually really passed very fast. When we have things to do, time pass. Today is my 61st, 61 already, and I'm very grateful that until today, my friends are still with me, and I have 61 guests with me until today. Yeah, thank you, thank you. Yeah. My friends are coming. Come, let's share. Prima, we can share our page to your page and then share to your friends. Yeah, this time we can share. Hello, my friends. So that come in, say hello, good morning to me. Hello, 丽花. Thank you, 丽花. Yeah, 丽花真好, 丽花. I mean, I'm thankful to all my friends that who always support me. And 丽花 is really one of them that support me from the very beginning until now. Yes. Come, my friend. Yeah, Ivy also say me. Ivy was my last week's guest. Yeah, we having fun talking. Li Jin also, thank you. Yeah. Yeah, today is actually what do you call that? Today I'm glad to have my friend, my laughter friend, and she's an awesome lady. I should say is Prema. We call her Prema in short. So her name is 𝗕tože Sundram. Yeah. So she's a very awesome lady, which we're going to talk to her now and then. We don't want to waste so much time. There's so much things that she can share and she can encourage us in many ways. So I shall now welcome the occupational therapist, for Johor State, head of Johor State. Anyway, that is what she worked as in the hospital. But there are many things as an individual that she can share with us. Okay, so now I shall welcome Miss Prema to be with us. Yeah.
Hello, good morning, Auntie Boleh, and good morning to everyone. Hi.
Yeah. Good morning. It's awesome to have Prema with us. Yeah, Prema.
Yeah.
Yeah, I'm so happy to have you with me. Yeah, Auntie Boleh is here because yeah, we have been to hospital with you, join you a few times to laugh with your patient. So this occupational therapy, sometimes we can talk about that because there are so many therapy. Last time I was once mixed up like physiotherapy and this kind of therapy. There are so many therapy, right? So Prima, maybe you can just for short tell us actually what is occupational therapy in fact. Yeah, thank you. Yeah.
Thank you, Auntie. Yes, many people are confused when I say I'm an occupational therapist. They say, what is that? Are you going to occupy patients? Okay. In fact, I'm very lucky. I'm the third group trained in Malaysia. I'm already in this service in this line for past 31 years. See how long? I mean, I started in 1980s. And I'm the third batch, one of the pioneer batch trained in Malaysia. So till now, I'm still educating people what is occupational therapy. They get confused when patients come to me, apa you nak buat? Okay, actually, what our aim is, we want to make patients to be independent after they have illness. Because many patients, so once they got sick, they don't want to do things. They have more like sick character. They don't want to take care of themselves. They're depending on people. Simple things also they don't want to do. They just like to lie down. Okay, what will happen if you lie down too long? Your body become more weak and you become more bedridden. So we don't want that thing to happen. So what we will do, if patients that have any temporary disabled or permanent disabled or anything make them disabled, they will send to occupational therapy. We'll make sure them to be independent in their daily tasks. So our job is we teach them how to eat, how to bathe, how to dress up, and even if they're driving, we want them to go back to their normal life. We teach them how to driving, like school children, like cerebral palsy, they don't know how to use the pencil. We teach them how to use the pencil. Even we teach them how to use the wheelchair. So in short, what you want to say that we want patients to be independent and functional and be happy. That's why my patients call me Cikgu. So we are the Cikgu in the hospital.
Oh.
Okay.
Yeah, I still have a question. You see, when you're talking like you are like a cikgu, like a mother and everything, they you start teaching them. I mean, of course, they have their parents or whatever at home. But when it comes to, you mean people who are, in a way, even though they are not sick, but then they are not so mobile in a way. So that means those, is it orang kurang upaya also they come, is it? So those people, they are not so familiar of their motto, all these things, not so good.
Yes.
I see.
Normally, I see a lot of stroke patients, stroke after they had a stroke. They don't, because they've been using two hands, suddenly they have to learn to use one hand. So we will train. Not only we do train, we also very creative. We do modification, lot of modification. We adapt the spoon to cut the spoon. Maybe they're holding like this now. We make it like a pocket. We still can function. If they don't know how to do buttoning, we change the baju to Velcro strap and thing. We give idea for them. We have also spinal cord injury. They were normal person, suddenly they become OPU, they don't know what to do, they become very depressed. So this is where I do a lot of psychological support. And at the end, they must know, take care of themselves, no need to depend on people. That's what our goal.
Oh, so it's more than what we think, actually. You see,
yes.
you're not only teaching them, so you must have idea of how to how to do things in your way to suit them, to make it easier, simplify the thing, and yet it's very useful for them. So you know, and then you all must able to have a lot of ideas, to do up to things to suit actually very individual, because they are of different criteria or whatever. So right. Wow.
Yes. This is where because our scientific knowledge, our scientific background knowledge is to learn about the muscle. But I know this muscle is weak, which one to compensate? So we use the compensate method sometimes to train them. And we have to be really use a lot of craft and creativity. So to be occupational therapy, you need to be very creative. There's no one method. So there's a multiple method we can try and really enjoy.
So my dear friends here, if you have anything that you like to ask Madam Perema, or anything encouraging words or whatever, please feel free to write down in the chat, because I feel this is a time that we were able to actually encourage each other. Yes. Thank you. Your friend is Shani say, wow, very impressive. Yes, to me it's always I find that I thought it's physiotherapy, those people go, so this is actually after the physiotherapy, people continue from there again.
No, not necessary. Because we start together. As a team, we start together. Because we want to wait for the muscle to work out, will be too late. Normally, whatever function they have, we'll polish the function and make it upgrade. Like example, I have a spinal patient, they can't even, before this, they were driving, they were going back to, they're working. When they come to me, they totally lembe, they can't do. So this is where we encourage them. I say, no, you still can use this hand, or we modify your equipment. They say they cannot touch behind, we make it long handle, so they can comb, they can eat. Even we suggest modification of the car. So I'm very happy I have a spinal support group. Majority of my spinal support group, they are driving, they are independent, they are in the community. I'm very happy to see them. So this is where we train them to be independent. Boleh, we say boleh, you must do it. But we are there behind to support them to do it. And I normally, to do this, I need to work with many agencies. I work with this JPJ for driving. I work with school system for children with disabled. I work with SOCSO to get their equipment. I work with many NGOs, so that I need I cannot work alone. I need all. I work with the 𝗕𝗏𝗏𝗃 Joyous Club for their psychological support. They are there to support my patient with more psychologically, and we make them happy.
Yeah. Well, it's awesome actually. You see what Perema do, and then we don't know, because actually sometimes we Auntie boleh, even though we have this from government side, but we as an outsider in the picture, we also really want to know what is this and how you operate. This kind. Let's say people who wants to apply, they have, how would they go about it? Let's say.
Okay, normally we need a referral letter. Our referral is you can go to any clinic kesihatan. Just tell the doctor, I am having let's say you are having weakness, you want to learn to be independent again, or you have anybody, friends, that they are just staying at home, they are not doing anything, become orang kata consider like a very, very okay, you're not trying anything. So you just go to any clinic kesihatan, ask the doctor for referral to occupational therapist and we'll take over.
Oh,
It's easy.
yeah. If you have any friends, yeah, I mean the step is not that difficult. You go to clinic kesihatan, they'll give referral letter, then you will assess from there again, all right? In a
Yes,
way, yeah.
yes. Yeah, we assess. Before this MCO, we used to do home visit. Sometimes patient unable to come. Not home visit, not to teach. I mean, not to do the treatment at home. We do home visit. We see how the home affected the patient's lifestyle. So from there we give idea, modification they need to do, and we also normally we do a lot of carers education. Also, we empower the patient. We empower the carers. What activity to do as a home program. Sometimes patient ingat, they come to hospital saja, all we do. No, we want them to be empowered. Don't depend on therapists. And in fact, I learned a lot from my patient. They taught me a lot. They say, Prema, ini cara tak betul. Ini lagi senang. No. Kata, oh, bagus. I learned from there.
Yeah, because they're so sure. Yes.
Yeah.
Pemulihan cara kerja.
That's why we use occupation. Let's say a person is a housewife. I use the housewife as an activity to recover them. If a child, I use a lot of play. I play with them. I play with all kind of games with my children. I don't let them sit there. I say, okay, angkat tangan, bongkok. No, I play because when they play, they move the muscles. So I will ask what game you like it. So from there, the therapist will expand. The occupational therapist will expand. Normally, when they come to us, we'll ask, what you like to do? Some patients, they say, I like to do sports. So then we will bring patients like bowling. We bring them to Angsana last time before MCO. We bring them bowling, bring them archery. We bring them to taman kanak-kanak, play games and everything. So when they take, there's one thing, important quote in rehabilitation, what we call is true imitation and trained imitation. True imitation means you must have your heart to do it. That sustains very long. If a trained imitation, if I force you to do, and the next day you won't do, your skill will go up. So in occupational therapy, we stress a lot about true imitation. We want patient willingly to participate, and the result is amazing, very good. And we can end at the end, I happy, patient happy.
Yeah. Wow, it's awesome, you even go to the house to see how is the environment of doing all these things. Yes. We want to say thank you. Actually, no doubt your government, but thank you for all the efforts you put in, that you and your team, that you already go for it, and it's really thankful that we have a team, our government servant really working on all these things. Yeah. You see, Prema, we also know that, I saw you say, you're in this, that you have a lot of, need to have creativity, and then you also learn from each other. But can you tell us, what are, of course there are daily challenges you will face. So would you like to tell what are some of the challenges that you face as a head of your occupational therapy department of Johor, and then what you are somewhat quite the pioneer of this. So what are the challenges as you face when you are the head of the therapy for that department or Johor?
Okay, me as a therapist, our biggest challenges, if you ask any therapist, our biggest challenges is when patient give up. We wanted to do, as our part, we like to do a lot for them, and when patient give up, that's the problem. When patients want to participate, they don't want to comply and everything. That's why in Johor we started this two support group. One is we call Persatuan Orang Kurang Upaya Johor Bahru. That is for adults. So whoever patients we know they're having a permanent disability. For temporary disability, like they had a hand injury or they have a mind stroke, I have no problem because they know the recovery period is very fast. But tapi bagi patients yang we know is a permanent disabled, like a spinal cord injury, like amputation, they be amputated, or they have a very bad stroke, the adults, or they had a bad nerve injury, like brachial plexus, they can't use their hand. This patient will tend to go to depression. And one thing I see, patients don't want to listen from the therapist. They say, no, you senang cakap, you apa tahu? They will say that. Because we are teaching them. Dia kata, you don't know, you tak tahu apa saya rasa, saya tak mau. In fact, I come across a patient was during my training time, a patient spit on my face. You got very angry and you spit on me. They say, you keluar, you bodoh, you pergi. You shouted at us all because they think you are a normal person. You don't talk to me. I am sick. So this is the biggest challenge I faced. So what I did is I used patient. This support group, we form a support group. Patient who I said graduated, sudah dapat PhD now. They are all already master. They are very independent. They are working. They can do everything. I call this patient to give emotional support for them. And I find this way much better. Patient like to learn from another patient. So we are the therapists, we'll guide them, Once they feel confident, the patient will tell, no, consider my alumni patients yang dah graduate semua tu, dia kata, apa pergi ke cara kerja. Mereka akan ajar, jangan saya pun macam ni juga dulu. Dia orang ajar saya, they will learn you, they will teach you and everything. So through that, I find my work much easier from the support of the patient. Another thing that I find is challenging for me when community, when carers, they sympathize with patient. I don't like people to sympathize because when you sympathize, you spoon feed them. They won't learn to do things. I prefer them to be empathy, because when you empathy, you will understand the patient and you will help them to recover. Like a proverb said, give a man a fish, you can feed him only one day. Tahu kita bagi ikan one day saja. But if you teach them to do the fishing, you give them a freedom in lifetime. So here I teach them the fishing. I don't want them to give fish. And many carers, many family members sekarang dah tengok, you kesiannya. They have the impatient. Mereka tak boleh sabar. Because patient will take time to do because they learn a new technique to be independent, to be function. So sometimes carers, they are impatient, especially for parents with children disabled, cerebral palsy or anything. They kata, oh, saya tak ada masa, saya mau cepat-cepat dia feed. When the child is 12 or 15 years old, still been feeding. So this is the mainly I face. Like one is patient's attitude, another one is the carer's attitude.
Yeah. How about the percentage of the children, if for the whole children and the adults, what are the percentage?
I think it's almost same, but currently I noticed that the current referral that based on my department, I dare not to say, but other setup based on my department based in Johor, currently we're getting a lot of referral for children. Children means they're not disabled, it's more on behavioral issue. Lot of children are referred to us for behavioral issue, mainly speech delayed. Children don't know how to control their emotions and everything. So here, a lot. So our waiting time is a bit long, but we don't make it that as an excuse. What we do is from our I have this another support group we call Persatuan Rakan Celik PP. Rakan means a friend, Celik means open your eye, PP means physical, intellectual, psychological intervention. What I do here is we do the training for parents. We do training for parents. We empower the parents, be confident, to be more to observe what the children's behavior, and they will come here, they learn from here, and to continue the treatment at home. And to do that, we also have Facebook. In my department, we also have a WhatsApp group. They can always WhatsApp and ask from the therapist. I have this problem, what to do? Because now with the MCO, ramai takut mau datang hospital. We also don't advise patient to come to hospital banyak, because of we have to maintain the social distance. But we don't stop them. They want to come, they come, but they always can get consultation to what we call tele-rehab.
Oh, but this one.
Through phone call and through video call also we do the rehab. They take the video and we discuss cases through video call.
So now also actually it's also good nowadays. It's so convenient. Like nowadays, like
Yes.
hospital also video call to check on you on certain thing. Just
yes.
Perema, you also, so I see you also the advisor and founder of the Persatuan Orang Upaya Johor Bahru and Persatuan Celik PP. So this Celik PP Johor Bahru. So these are the two NGO that she 𝗕MA, the founder, the advisor. Yeah, thank you so much, 𝗕MA, yeah, thank you so much for sharing of what you have done. I mean, what is you are currently doing. And now we are going to share something about 𝗕MA as a person, as an individual. You look at 𝗕MA, the way she talk, and the way she smile, and the way she laugh. When we used to visit her, I mean, in the occupational therapy, this one we do some activity there. You see, 𝗕MA, because I'm so sorry, I didn't know. Yeah, we're going to talk about that journey that you have gone, so far. That I came to know that, you see, 𝗕MA, she is actually a breast cancer survivor, right? Yeah,
Yes.
yeah. So
Yeah.
𝗕MA told me she got it last year, right? Last year, February, when you started to know that there is a lumps in your breast,
Yeah.
and
Yeah.
𝗕MA, can you just tell us how have you gone through this? The
Mm.
feelings when you discovered that you have breast cancer, and how did you cope with this? No, we would like to share. And friends, if you have anything that you feel that you want to share your feelings toward 𝗕MA, please write down. Yeah, 𝗕MA, thank you for sharing. Come, you tell us how do you cope your feelings during that time? Yeah.
Okay. First thing is it's me. I have to control my ego. Because being in top, I mean, in public service, I'm considered one of the top people. I always advise people, programming people. So I never I had it crossed my mind I will fall sick. Uh, when you become a sick, it is the biggest shock in my life. I detected a lump in my left breast in February last year. I must thank you to the breast cancer support group, because when I also used to go and give talk to them last time in 2018, 2017, Doris and Bama, and I met them, and they taught me how to do the self-examination. They say, Prema, you're already 50 plus, you better do it. I don't know, maybe God was guiding them. To tell them to do me. So since then, I'll be doing the breast examination myself. Since 2019, I started to do that. 2019, because I'm already reaching 53 that time. I'm sorry, 52. I'll be doing, and once a month I do. So in February, I remember when it was a Valentine's Day. Yeah? Everybody was happy and smiling. I was doing my breast examination, and suddenly I find a lump there, and he was very shocked. And my husband have a program for me to celebrate our Valentine. So the whole day I just keep quiet. I cannot express the fear in me. I just hide it. I say I don't want to spoil the mood. I don't want to spoil the day. I didn't tell anybody. I just keep quiet because I didn't. And I'm denied. I cannot be. Something wrong. Something wrong. It'll be okay. It'll be okay. I deny it because I'm a human being. I don't want to accept it can be dangerous. I just let it go. I say never mind. After 1 week, I say, I dare not to touch my breast. I don't want to, I just totally ignore, like what other people did. I don't want to ignore. I just, tengok. I don't want to, if people say anything, even I will use my brows, I don't want to look at my left breast. That fear I have, I don't want to touch, I don't want. So after 1 week, suddenly I feel, no, I was telling to myself, I'm medical staff. I must let go my ego. I'm a human being. I must accept I'm manusia. I'm a human being. I can fall sick. I have to accept that. So what I did, I did a self-examination, and for my shock, it become big. It become like a lima kasturi, the small lima. It turned up to that big, the lump. And but there's no pain, nothing. Then I really got shocked already. Then I said, no, no, no. This time I cannot wait anymore. I must do my action. So what I did is I went to the hospital. I did the mammogram. This is the baju I'm wearing. That's why I wear this baju today. I was praying hard. I was praying, God, please, like begging, I did so many things for people, so many things, like I'm begging. Please, the result be negative now. And the result came, they said, Prema, we are very sorry, you are positive, and your cancer, the type is very dangerous. It can spread very fast to other part. You must take action immediately. The time I know, the first thing I was crying and crying and crying. Huh? And luckily my husband was with me. My husband said, he said he cannot stand me crying. He said, I never seen you crying like this. What happened to you? What happened to you? And then I don't know what to tell. I just, that time I took me 3 days. I never tell to my children also, because my children are all that time, all in university, all in KL, they're not with me. I and my husband was alone in the house. I didn't tell to my family members, nobody. I just want to be myself. I locked myself in the room 3 days and I was crying. I really cried. I cried and cried. Then I was thinking, then suddenly struck in me about the laughter therapy. This is where we say we need to know. Suddenly came in my mind about the laughter therapy. Why it struck me in the laughter therapy? They said, when you are stressed, in the laughter leader training I went through, I'm a laughter leader. They said, when you are stressed, you will release more cortisol. If you release more cortisol, your immunity become more weak, and the cancerous cell can be separate more easily. But when you are happy, you laugh, even it's a fake laugh, even it's not come from your heart, it's fake, you will increase more happy hormone that they call dose. I call that, every time they ask, now, I see dose yourself, that means dopamine, oxytocin, serotonin, endorphin. They say, just 10 minutes laugh. Then I said, yeah, there's another alternative. Why I give up in my life so simply? I said, why not I laugh? That's the day I started to laugh in my room. My husband was so panicked, asking me, Prema, are you okay? What's wrong with you? What are you doing? I just started to laugh and laugh, Then after the 10 minutes, I take my time and laugh. Then I feel something like big burden went off from my body. It's really, I feel. I'm not cheating. I'm not, because I've been doing laughter before my illness. I conduct laughter with my patient, but I don't feel the impact. I don't feel that person. No. But when I had it, when I was very down, I don't know what to do. I say no. I have to build up my immunity. I must come back. I must dose back myself. That means I need my good hormone. So that's how I started. Then I told my family members, and they started to cry. All of them crying, and all of them rushed back home, and they came back and they told me, oh, wow, they don't know what to tell. They say, the most soalan yang I hate to receive is, oh, you are medical staff, you boleh sakit Huh? Why, You staff pun boleh sakit You're supposed to be very strong. They said, no, what happened? Why, You're medical staff, you will sakit. That's the thing. I told them, I'm medical staff, but I'm human being. Look at me as I'm a human. I'm a human being. I can fall sick anytime I can fall sick. So I end up give them reassurance. Don't worry, I'll be okay. I'll be okay. In fact, my elder sister, she fainted when she hear me. I had a cancer. That time she was in Putrajaya. They have to bring to A&E. Ambulance came to the house, take her to the emergency department. They have to give her oxygen. She just panicked and she fall. And I didn't tell my mother until I recover, because I know my mother is a very weak person. I didn't tell her anything, but whenever she called me, I'll be laughing with her and smile with her. But I never do video call. She asked me, hey, Prema, why suddenly now you don't want to video call? I said, no, I don't want to do video call because my hair all dropped. I botak, my face changes. I don't want her to suspect. I always call, but I never do any video call. I never tell anything to my parents, to my mother. But after that, my sisters, I need to give counseling to them. And then only I break the news to my staff. Funny things, when I told my staff I have cancer, all started to cry again. That's why I can see their love to me. They say, Puan, ni kena tak boleh terima Puan. Kenapa Puan? Kenapa Puan? When I see them crying, I also started to cry. So then thank God what they said. No, power of universe. For me, everything came to me back very fast. Since the day I diagnosed, the 5th day I already started my chemo. They did very fast for me because the doctor said it's quite dangerous. I need to do fast. I sit there, I start my chemo. Okay, I was not prepared for chemo. Actually, frankly speaking, I don't know. I see patients, but I don't see much of cancer patients. So I know chemo, the hair will drop. I know that really our patient become very weak. But when I went through the chemo, I thought it is the biggest challenges I went through. It is very big. The pain, the body changes, the smell, you become okay. You become okay. There's a time, at one time I was bedridden. I can't even move. The pain is so terrible. Normally, like therapists will ask, no, apa sakit, 1 to 10 your scale. I will give the scale 10. I can't even move my hand after the chemo. Even you wanted to do, I can't move. And lucky thing, I have a good support, friends, all. I think a circle of friends is very important. Don't ever give up. Don't be ego. Don't live alone. This is the time you need your circle of friends. Baru episode Joyous Club, Madam Michi, she's the one who always call me and tell me, Prema, dah ketawa ke belum? Then I will say, no, madam, I'm too pain. I cannot move. She said, never mind. Just do a simple do. Ha, ha, ha. Oh, ho, ho. So I said, oh, can do that. She said, yes. Even you don't have anything, just bring out X-ray. Just do something, tapping, just gentle tapping. She just check on me. She's very rajin check on me. And Niji also always give me support. Then I say, no, I have to change my mind. During that time, I learned is mind power. Your mind is very, very important. If your mind is strong, you can face it. So there's another quote, they say, change your perspective can change your life. So what I did, I said, okay, the pain is in the body, but my willpower, saya masih kuat. I will do it. What I did is, during this time, even though after chemo, I try to explore my leisure. I do a lot of things. I did continue my studies, online studies. I finished my 2 module on sensory integration. I did on driving for driving rehabilitations for people with disabilities and elderly people online. Then I did my course on vision therapies for children, and I also did on mind power. So throughout my 1-year journey as a cancer patient, I did I involved in a lot of studies, so that I just direct my mind rather than focusing on negative things. I look at what is my abilities, what else I can do. So I focus on that. Other than that, I should start doing cooking. Before this, my cooking was not good. I'm a very person. I'm very chincha. I will make very simple cooking. So during this time, I installed TikTok. I installed YouTube. I learned from that. Every day I will cook. And the funny thing is, during chemo, you don't have a taste and you don't have a smell. I become a chef. My children say, "Ma, wow, you become a chef. I can cook without tasting. I know how much sugar to put and everything." So every day I will try different recipe, different things. And the most important is my family support. My children all came back. They all decided that time they were doing online. They were studying in KL. 2 of them came back, and all 3 of them also came back. They said, "Ma, we want to make sure you recover well. We don't mind doing online classes." So they was with me until early this year. Early this year, they were with me, and they're the one who really support me. And my husband is there, but my husband is a police officer. He was very busy. Most of the time he was not at home, but I understand him. But he always support me whatever I do. But the funny thing, till now, when I recover, how he was shocked when he hear me laughing in the room. He thought I'm going crazy. Suddenly I started to laugh. No. So this is how I cope. The important thing is your mind power. They always say, you saw whatever you saw, that's how you reap. Apa-apa you tanam lah. If I tanam kacang panjang lah keluar. If I tanam tomato lah keluar. So what I tanam is, I will recover. I will be strong in mind, and I always look at the positive thing. And thank God, during my journey as a cancer patient, I see a lot of people with willpower. I like to share one story. During my 3rd chemo, I went for my chemo. I saw this one auntie, Chinese auntie. She is, I think, 70 plus. The nurse was advising. She also going for chemo. I think her chemo was a 5th chemo. She went for the 5th chemo. I'm the 3rd chemo. She's the 5th chemo. The nurse was advising, Auntie sudah tiap-tiap bulan ambil chemo. Kalau auntie tak sihat, auntie minta doktor cuti lah. Auntie sudah 70 lebih, minta doktor cuti. And this auntie, she look at her now. Apa cuti-cuti? Badan okey lah, sakit sikit-sikit saja, habiskan sajalah. Ini semua mau sinilah. Oh, 75 years old. I look at those, I was so amazed. I was still telling her, wow, Look at her willpower. They said, nah, Auntie tak ada sakit. Sakit, apa ini semua boleh habis. Ini mau kuat. Ini kuat, apa-apa boleh buat. Dia kata, tak apa, you cucuk habis. Saya mau habiskan cepat. Saya tak mau lagi duduk-duduk. That is one of the things when I see her, I look at like a god, and I go, wow, this 75 years old lady can do. I'm only 50 plus. What? I also can do it. Indirectly, that's one of the lady. If I meet her again, I really will say thank you to her now. So my advice to whoever having an illness, anything, try to look positive things. People will plant some negative things in you. Don't go for it because everybody react differently. You must believe in that and believe in God. And my another advice, I've got so many advice, Auntie. I got so many advice now as a cancer now. Many people will tell you now, be strong, be strong. Please don't tell be strong only. Show them the way to be strong. Because when I was I don't know how to share screen, but I had this drawing. People will tell me, you pray hard. Okay, I know how to pray. I will pray. And they will tell me, take a good food. Yes, I will do good food. And most of them tell that nearly 60 to 70% who saw me, they said, no, Perema, you need to be strong. You need to be strong. In my heart, I will look at them now. Tell me the way lah, apa to be strong, be strong. Kita cakap saja be strong, I'm strong. Apa lagi saya mau strong? So, be strong means you all have to tell them how to show them the way. Like myself, I explore a lot of things. Being a therapist, thank God, I also learn a lot of things how to overcome my disability. At one time after my operation, I can't even lift my hand, so I was using my own modification, own hand modification, everything. They put a tube here to to drainage my fluid from the breast. And I have to carry this bag all around. So I find very difficult. So what I did is that I designed a handbag, like a handbag, a big bag. I put the tube inside there, the drainage bag inside there, and I go up. because people are feel very scared, they feel very shy when you have this tube with a blood fluid inside. You don't want to go out. So what I didn't do that. I put the bag inside, the tube inside the drainage bag inside my handbag, a big bag. Then I did go out. I just go out around my tamam. And please don't isolate yourself. When I had a cancer, I never ever isolate myself. I bring all my bed to the hall. I sit in the hall. I just like to see people come in and out. I watch TV and never isolate yourself because there's one theory. Because this one I learned, I don't know this theory before I become a cancer patient. This is one of my staff share a motivation book. It's written by one of the cancer survivor. I can't remember the name. What he said, he is a stage 4 cancer. How he survived? The tips he gave, something that I can follow is easy. Never ever isolate yourself. If you isolate, kalau you orang tarik diri, duduk seorang-seorang dalam bilik, you become more depressed and that will kill you. That's the isolation and loneliness. Loneliness will kill you. He said, don't ever isolate. Don't ever try to be alone. Talk to people. So this is the one. I come, I sit in the hall, I occupy myself with the TV, I keep in touch with my friends, I tell everybody, hey, I'm a cancer patient. Dia kata, betul ke? You happy je? I kata, ya. Change your perspective, change your life. I kata, even cancer, I belum doktor kata, I mati tau. I belum mati lagi, I ada cancer tau. Dia tak cakap, you akan mati. Saya kata, saya ada cancer, why not I try everything whatever I am? I will come up. This is how I went through. Banyak panjang
No, also actually, when you talk about your story, I feel like I want to cry also, the way how you went through. But then at the end, when you talk about the mind power, power of the mind is so strong that there are just a few keywords only. The mind power must be strong, and then not to isolate yourself. These two main things that does everything. And then I heard that you are sharing this thing. You are the one, but then you are the one who got the CA, but you are the one who encourage other people. You are stronger than those that heard about your news, So you really an inspiration to many people, for this point of view and your job. In fact, for so many things, just now I heard that when you share with us, you talk about you come to laugh. Okay, I know also you are the certified laughter yoga leader, and then you also the laughter ambassador, okay. And then recently there's a Johor Bahru Happy and Joyous Club. You have won first Malaysia Laughing Championship, right? Organized by Johor Bahru Happy and Joyous Club. So that was a time you still doing your chemo or something like that, right? Yeah. So you see, you told us that during this time laughter helped you, and then you during this chemo time also you joined this laughing championship. Would you like to share with us how do you feel, and when you won the championship, how do you feel, and what make you want to join this kind of championship organized by the club? Yeah.
Yes. Firstly, I must thank you to Johor Bahru Happy and Joyous Class to give me a chance to join this laughter, and thank you to Madam Ming. She's the one who asked me, Perema, come participate in laughter championship. Initially, I said no. I said no, Madam. I don't know what to do. I don't know. Then that day she said no, join. Then actually, my intention to join this laughter is not to wait. I was telling her, why not I become a role model to others? I just want to give a role model. I give like a emotional support at harapan. No, there's when I that time I already told myself I will declare I'm a cancer patient. I want to tell, not to say to get sympathy. No, I don't want anybody to get sympathy. I just want them, others who are go for cancer. I want to get motivated. That said, we can do. So one of my favorite laughter during my cancer, but this one I don't know. Maybe some people will take it as maybe they take it as sensitive. But one of my favorite laughter is I always take my lump out like this from my breast. Oh, I pull it out. Come on, you naughty! Who asked you to stay there? Come on, I hate you. Then I pull it out. Then I shoot that. Bang, 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 bang. I laugh. This is what I will do every day in my balcony.
Yeah, you see, laughter is so contagious. You see, when you laugh, people watching also will follow you. You see.
So every day I pull out. Then I will tell no, naughty, don't go anywhere. Oh, I stop here. No. Go. You destroy. Then I take it out and then, ooh, I destroy you. Boom! Yeah, I know. I just creating. I talking to myself. I be laughing. So I think I never stop laughing. Every day I take my own record. I'll see how long I can sustain. But my advice is initially after chemo, like 2 days, 3 days, please do a very low level of energy of laughter, because chemo will affect your stamina, your heartbeat become increasing. So I take my BP. When I laugh, I keep my BP set on the side. So I look at my BP, my heart rate, and everything. So I just want to actually my goal to participate in this, to give motivation, to inspire others who are having a chronic illness to give up in this life. Please focus in. There's so many positive things, and dying is not we decide. God will decide. You don't tell tomorrow I'm going to die. Today I must be sad. Today is today. Enjoy the day. That thing I learned from during my journey. Anybody can die. Yes, anybody can die. But don't think of every cancer patient will die. Every cancer patient become worse. No, this is a period we'll go through. So that's why I willingly participate in this laughter, and with support from everybody. I won the competition. Thank you very much. It's something that I'm very proud. I'm very, very proud. Even I'm a
We are proud of
patient.
you. Yes.
I won this. Yes, thank you.
Yeah. Prima, we are so proud of you, really. You won the first Malaysia Laughing Champion. Yes, that's for Malaysia. But in the world, she joined that, and then she
Yeah.
won the fourth place. So, no, Prima, for all what you have shared, we are actually feeling that you are so awesome. You're inspiring us, and then we are so proud of you, to have a friend like you who is so strong. I mean, of course, they are weak, but then you're able to share. And that's something
Yeah.
that very encouraging. You see,
Yeah.
yeah, this thing that you have told us so many things that as a job, as an individual, what you have gone through, and how you manage to cope, at least at a certain point, you're able to cope. So before we end this session, because so many things that you can tell us, just you see, like during this pandemic time, okay, there are not much thing that we can do. So for you, Prema, would you like to give any tips or advice on to our viewers here, uncle, aunties, especially on the areas of coping during this pandemic? Yeah, what we can do?
Okay. Okay, first thing is, as what I said, your mind. I always tell everybody, your mind can be your good friend, and it can be your worst enemy. All start from your mind. When you look at things negatively, it turn negatively. When you start looking at things negatively, your mind, inside the mind, we call one system, we call amygdala. The system will trigger your stress level, your mind. So I always tell everybody, even we are going through this pandemic, tough time. Everybody have problem. Everybody think, but look at the good side of it. And another thing is, whatever we learn, we must practice. Some people are like, I know people, we are telling people to laugh and laugh and laugh. People sometimes they just listen, they never practice. No, because I know knowledge is power, but it becomes more powerful, more efficient when you practice. So I like to tell to everybody, first thing is look at things beautifully. I can say now, say, Auntie, kawan-kawan semua, tengok semua, tengok yang baik-baik, tengok yang positif. I told myself after I become a cancer, till now I'm practicing that. Whatever I see, I look at the beautiful part. As a head of department, when I come to my department, sometimes I see things are stressed up now, sometimes I see things, but I don't look at the negative. I thought, wow, today, like says, I have a file of work to do. Wow, so many files on my department, on my table. I won't say, alamak, banyaknya file. I don't say that. No, I thought, wow, today got so many files. I got strength. I'm trying to finish at least 50% of the file. I replace everything in positive words. So yes, your mind, control your mind. It's not easy, but you, by practicing, you can do it. You can empower yourself. This is advice I can give. Make your mind as a friend, not your enemy. Thank you.
Thank you. Really, Prema, thank you. It's our mind. Yes. When you see Prema, she able to do it. I think if we want, we can do it. As what Prema said, we have to accept that we want to do this thing. Yeah. By just thinking and it's two different things. Thank you so much, Prema, for sharing all these wonderful things to us. I feel so touched by your story. In fact, really,
Thanks.
many of us here really, we feel proud to have a friend like you who is in a way that you can advise to us in this stage, rather than we people feel for you or whatever. Thank you very much. Yeah, it's an awesome meeting with Prema. We hope to when pandemic over, we hope to go again to your hospital and we work after.
Okay. Okay, thank you, Auntie Bonnie. Okay, thank you for everybody. Okay, Miss Song.
Yeah, bye. Wow. Yeah, it's I feel at one moment I feel very touched. You really very emotional about that. Thank you, Prema. Able to share what she has gone through. As a breast cancer survivor. And so she said, "Hey, I'm a doctor. I mean, I'm not a doctor in the medical line or whatever. How can I get sick?" But then she's able to, until now, she's able to go through, and she has said that doctor helped her and the positive mind and not been isolated. Yes, thank you, Prema, for sharing all this. Is really awesome. That's why I say she's really an inspiring lady. She shares so much with us. Yes. Yeah, even Susan Low also nice. She say, thanks, enjoy the speech and be positive. Yes. Everybody actually from here, people really learn that the positiveness in us is so important. Thank you, Prema, for sharing this one with us. Yeah. So this time, Auntie Boleh want to say bye to all of you, and even your friend Patricia Lim want to say thank you for your sharing, Prema. So we have to say bye to everybody, and I hope today we learn together this very time from Prema a lot of things in our life, that things that may not be easy as what she said, but we have to adjust our own mindset first. Yeah, thank you very much for staying tuned to Auntie Boleh. So wait for another Saturday and see who will be my next guest. Yeah, it's always be the interesting one, something that we can learn from. Okay, so it's time to say bye bye. Keep sharing Auntie Boleh's Facebook page. Okay, so Auntie Boleh wants to learn, and I hope everybody can share my page at the same time. Okay, thank you. Thank you. So 5, 4, 3, 2, 1. Thank you, everybody.